Three foods, that's it. Three ordinary foods that most Americans already buy at the grocery store, but almost nobody over 60 is eating in the right way. And those three foods contain the exact compounds your spinal discs, joint tissue, and nerve fibers need to stop breaking down and actually start rebuilding themselves. And if you stay with me through this entire video, I am going to walk you through exactly what those foods are, why they work at the cellular level, and how you can start using them starting today. But first, if you are someone who has been dealing with chronic back pain, stiffness, or that nagging ache that never fully goes away, do me a favor right now and hit that subscribe button and turn on your notifications, because every single week we put out videos specifically designed to help people over 60 live stronger, move better, and feel younger than their age. And you do not want to miss a single one. Now let's get into this. Because what I am about to share with you is not some trendy wellness hack. This is not a fad diet. This is not a supplement company trying to sell you something. What this is real nutritional science that has been studied, reviewed, and validated by researchers who spend their careers understanding how the human body ages, and more importantly, how it heals. And when it comes to back pain specifically, the science points to something very clear. The pain most people over 60 experience is not simply the result of getting older. It is the result of specific biological processes that are starving your body of the raw materials it needs to maintain and repair the structures that hold your spine together. And when you understand what those raw materials are and where to get them, everything changes. Let me explain what is actually happening inside your spine when your back hurts. Your spinal column is made up of vertebrae, the bony segments that stack on top of each other from your tailbone all the way up to the base of your skull. Between each vertebra sits a spinal disc. These discs act like shock absorbers. They are made largely of a gel-like substance surrounded by a tough outer ring of fibrous tissue. The inside of that disc is made primarily of water and collagen, a structural protein that gives tissue its strength, its flexibility, and its ability to bounce back under pressure. When you are young, your body produces collagen efficiently and continuously. Your discs stay hydrated, thick, and resilient. But starting in your 40s and accelerating through your 50s and 60s, collagen production in your body slows down dramatically. The discs begin to thin, they dry out, they lose their cushioning ability, and when that happens, the vertebrae above and below them start to compress in ways they were never designed to compress. That is when you feel it. The stiffness in the morning, the aching when you stand for too long, the shooting pain when you bend the wrong way. That is collagen depletion talking to you. And here is the part nobody tells you. You can do something about it through food. That brings us to the first food, and this one has been around for literally thousands of years. Every culture on Earth, from European grandmothers to ancient Chinese medicine, has understood instinctively that broth made from simmered animal bones has healing properties, and modern science has now confirmed exactly why. Bone broth, made by slow simmering animal bones, joints, and connective tissue for many hours, releases collagen directly into the liquid. When you consume that broth, your digestive system breaks that collagen down into smaller chains of amino acids called peptides. Those peptides are then absorbed into your bloodstream and transported throughout your body, where your cells, including the cells that make up your spinal discs and joint cartilage, use them as the direct building blocks for new collagen synthesis. Studies have shown that regular consumption of collagen peptides, exactly the kind found in bone broth, can significantly increase the density and hydration of spinal disc tissue. It can also rebuild the cartilage lining in your joints, which is what cushions the bones in your hips, knees, and the small facet joints along your spine. The glycine, proline, and hydroxyproline in bone broth are the exact amino acids your body needs to manufacture new collagen strands. And the beautiful thing is that this is not something your body has to work hard to access. When you drink bone broth regularly, you are essentially giving your spine a direct supply line of raw materials. A good bone broth should be simmered for 8 to 12 hours minimum. The longer, the better. You want to see it gel when it cools. That gel is the collagen. That is what you are after. 1 to 2 cups a day, warm, with a little sea salt, can make a meaningful difference in how your joints and discs feel over the course of several weeks. Now, I want to take a moment here and share something with you that I receive messages about all the time. I want to tell you about a man named Leo. Leo is 69 years old and lives in Phoenix, Arizona. For the better part of a decade, Leo had been dealing with what his doctor described as degenerative disc disease in his lower lumbar spine. He had two herniated discs, the L4 and L5 levels, and the pain had become so severe that there were days he could not walk from his bedroom to his kitchen without stopping to hold onto the wall. His mornings were the worst. He would wake up feeling like someone had poured concrete into his lower back while he slept. He had tried everything his doctor suggested. He had done the physical therapy. He had taken the anti-inflammatory medications. He had gotten the steroid injections. And while those things gave him temporary relief, nothing was changing the underlying problem. His discs were still deteriorating. The pain kept coming back. Leo started doing his own research, the kind of research that most people do not have time for or access to. And he came across the same nutritional science we are talking about today. He decided to commit to a 6-week protocol. Every morning he started his day with a mug of slow-simmered bone broth made from grass-fed beef bones. He added broccoli to at least one meal a day. He started eating black beans 4 to 5 times a week. By week 3, he noticed that his mornings were different. The stiffness was still there, but it was softer, shorter. By week 6, Leo told me he had walked 2 miles without stopping for the first time in 4 years. His pain had not disappeared entirely. He was clear about that. But the quality of his daily life had shifted in a way that medication and injections had never managed to achieve. Leo's story is not a miracle. It is biology working the way it is supposed to work when you give it what it needs. And that brings us to the second food, and this one might surprise you because most people think of it purely as a vegetable for general health, not specifically for back pain. But broccoli contains a compound called alpha-lipoic acid, and alpha-lipoic acid does something that almost nothing else in your diet can do. It regenerates and protects the myelin sheath, the protective coating that wraps around your nerve fibers the same way rubber insulation wraps around an electrical wire. Here is why that matters for back pain. When your spinal discs compress or herniate, they often irritate or press against the nerves that run through and alongside your spine. That nerve irritation is what causes the burning, the shooting sensations, the numbness, and the tingling that radiate from your back down into your legs, a condition many people know as sciatica. The problem is not just the mechanical pressure. The problem is that inflamed, compressed nerves also experience damage to their myelin sheath over time. When that protective coating degrades, the nerve signals become erratic. Pain signals fire when they should not. Your brain receives confused, amplified messages of pain even when the structural cause has been partially addressed. Alpha-lipoic acid from broccoli acts as a powerful antioxidant specifically inside nerve tissue. It neutralizes the free radicals that are damaging your nerve coatings. It supports the regeneration of the myelin sheath. And multiple clinical studies have shown that consistent alpha-lipoic acid intake can measurably reduce neuropathic pain, the nerve-based pain that is so often the most stubborn and frustrating component of chronic back conditions. Broccoli is one of the richest dietary sources of this compound available, and the way you prepare it matters. Light steaming is best. Heavy boiling destroys much of the alpha-lipoic acid content. 5 to 7 minutes of steaming, just until it is bright green and tender, preserves the majority of the active compounds. Aim for at least 1 generous serving per day, and try adding a drizzle of olive oil after cooking, because the fat helps your body absorb the fat-soluble antioxidants more effectively. There is something else broccoli does that directly supports spinal health and is almost never talked about. Broccoli is rich in vitamin K2, and vitamin K2 plays a critical role in directing calcium to the right places in your body. One of the problems that develops with age is something called calcification, calcium deposits forming in soft tissue where they do not belong, including around spinal joints and disc spaces. This can create bone spurs, stiffness, and additional sources of nerve compression. K2 essentially acts as a traffic director for calcium, guiding it away from soft tissue and into your bones and teeth where it belongs. Eating broccoli regularly supports this process naturally, which over time can reduce the formation of new calcification and support the structural integrity of your spinal joints. Now let us talk about the third food, and this is one that many seniors have been incorrectly told to avoid because of outdated concerns about gas or digestive discomfort. Black beans. These humble legumes are among the most nutrient-dense foods available, and for anyone dealing with back pain and nerve-related symptoms, they are something close to a superfood. The reason comes down to 2 key nutrients, magnesium and B vitamins, specifically B1, B6, and B12. Magnesium is one of the most critically underconsumed minerals in the American diet, and its deficiency is directly linked to muscle cramping, nerve hypersensitivity, and spinal muscle tension. The muscles running along either side of your spine, your erector spinae, are among the most magnesium-dependent muscles in your entire body. When magnesium levels are low, these muscles stay in a state of chronic low-grade tension. They do not fully relax even during sleep. That is the source of the deep, dull ache that many people feel in their lower back when they first wake up. It is not just disc degeneration. It is mineral deficiency causing your spinal muscles to be constantly partially contracted. 1 cup of cooked black beans delivers approximately 60% of your daily magnesium requirement. That is enormous. And unlike magnesium supplements, which are often poorly absorbed and can cause digestive issues in some people, the magnesium in black beans comes packaged with fiber, phytonutrients, and other cofactors that support its absorption and utilization inside your cells. The B vitamins in black beans are equally important for back pain because they are the primary fuel for nerve repair and nerve function. B1, also known as thiamine, supports the energy metabolism of nerve cells. B6 is essential for the synthesis of neurotransmitters that regulate how pain signals are processed in the nervous system. And B12, which many older adults become deficient in due to reduced stomach acid production, is absolutely critical for maintaining and rebuilding the myelin sheath we talked about earlier. The combination of alpha-lipoic acid from broccoli working alongside the B vitamins from black beans creates a powerful synergistic effect on nerve tissue. These two foods essentially work as partners in your body, one providing the antioxidant protection, the other providing the repair fuel. When you eat them together regularly, you are giving your nervous system a comprehensive toolkit for recovery. Black beans are easy to prepare in large batches and can be stored in the refrigerator for the week. They can be added to soups, served alongside eggs in the morning, mashed into a spread, or eaten simply with a little olive oil, garlic, and sea salt. The key is consistency. Eating them a few times a week is good. Eating them 4 to 5 times a week is where you will begin to notice the neurological difference. Now let us bring this all together because there is a pattern here that I want you to see clearly. Bone broth addresses the structural side of your back pain by providing collagen to rebuild the actual physical tissue, your discs and your joint cartilage. Broccoli addresses the nerve protection side by supplying alpha-lipoic acid to guard and regenerate the coatings on your pain-conducting nerve fibers. And black beans address both the muscular tension component through magnesium and the nerve repair component through B vitamins. Together, these 3 foods are targeting back pain from 3 distinct biological angles simultaneously. That is why people like Leo see results that years of medication and injections could not produce. Because medication manages symptoms, these foods address causes, and there is no pharmaceutical drug on earth that rebuilds collagen in your spinal discs, regenerates myelin sheaths, and replenishes magnesium in your paraspinal muscles all at once, but 3 ordinary foods from your grocery store can. There are a few more things I want you to understand about making this work in your real life. The first is consistency over intensity. You do not need to eat enormous quantities of these foods. You need to eat meaningful amounts of them regularly over time. Spinal disc tissue turns over slowly. Nerve regeneration is a gradual process. You are not going to feel a dramatic difference in 3 days, but over 4 to 8 weeks of consistent intake, the changes in how your back feels can be genuinely significant. The second thing is hydration. Collagen synthesis and disc hydration both depend heavily on your overall water intake. If you are drinking bone broth daily, that helps. But you should also be drinking sufficient plain water throughout the day. Not coffee, not juice, not soda, plain water. At least 6 to 8 glasses. Your discs are largely made of water, and they depend on adequate hydration to maintain their height and cushioning ability. Dehydrated discs are thinner, stiffer, and far more vulnerable to compression and damage. The third thing is what you reduce. You do not have to become a perfect eater overnight. But it is worth knowing that sugar, refined flour products, and processed vegetable oils all promote systemic inflammation. And inflammation is the gasoline on the fire of back pain. Reducing your intake of these foods while increasing bone broth, broccoli, and black beans creates a double benefit. You are adding in what heals and reducing what harms at the same time. I also want to address something that comes up frequently in the comments on videos like this, and that is the question of whether nutrition can actually make a difference when the structural damage to the spine is already significant. The honest answer is it depends on the degree of damage and the individual. Nutrition cannot reverse a severe spinal stenosis or regenerate a completely collapsed disc overnight. But it absolutely can reduce the inflammation around damaged tissue, support whatever regenerative capacity remains, protect the nerve fibers that are still intact, reduce the muscular tension that is amplifying the pain, and improve the overall biological environment inside your spine so that any other treatment you pursue, whether that is physical therapy, chiropractic care, or guided exercise, works more effectively. Think of these foods not as a replacement for medical care, but as the nutritional foundation that makes everything else work better. Your body is constantly in a state of repair and maintenance. Every day it is making choices about which tissues to prioritize based on the raw materials available. When you consistently provide the specific nutrients your spine needs, you are essentially telling your body, this matters, fix this, put resources here, and your body listens. If you found this information valuable today, and I genuinely hope you did, I want to make sure you can come back to it. Go ahead and save this video right now so you can reference these 3 foods whenever you need a reminder. Share it with someone in your life who has been struggling with back pain because this information could genuinely change their daily experience. And if you want to go deeper on how nutrition, movement, and lifestyle work together to reduce chronic pain in people over 60, subscribe to this channel right now because that is exactly what we focus on every single week. You deserve to move through your days without being held back by pain, and the path back to that starts in your kitchen with 3 foods today. Dr. Michael Kent is a fictional educational persona. Patient stories, including John, are illustrative examples and not real individuals. Research referenced is based on peer-reviewed published literature. Always consult your own doctor before making health decisions. This video is for educational purposes only and does not constitute medical advice. Never stop or reduce prescribed blood pressure medication without speaking to your doctor first. High blood pressure is a serious medical condition requiring proper medical supervision. Individual results will vary. Hook 2 is best is pi script do 3,000 words. Main add 2 short CTA 1 in first, second, and last must add subscribe and comment your age and city. Add 1 patient story in the third middle of script and follow YouTube community guideline. Add a nuthantic disclaimer sure in the end of script.